Hi everyone, welcome along to the Fertility Support Singapore Instagram Live. It's our weekly thing, so it's so great to have you with us online. Thanks so much to Kim who stepped in for me last time. It's such an informative chat. She'll be joining us a little later on as well, but shortly I'm going to be introducing Sueann as well as Kim. We're going to be talking all about fertility tests and what sort of timelines and results and just sort of how to get across all of that. So any minute now I'll be having my guests join me and yeah, we can go on with our fertility testing chat. And so great to see all the familiar faces as well when we do these things, and yeah, just great to have your questions come in. So we had quite a few questions come in for Sueann and Kim, but don't forget you can also during the Instagram live you can also ask your questions and the ladies can respond to them. So I'm just waiting for Sueann to join us now. Sorry about the delay. Here we go. Yes, she'll be joining us shortly. And then once they're online, we can get on with our chat. Hello, Sueann. If you can see me, just trying to add you to the chat now. Hello ladies, just give me a moment. I know quite a lot of you have joined, so we're going to be starting our discussion any moment now. Here we go. Here's Sueann. Thanks everyone for your patience. We're just connecting. There she
Hi.
is.
Hi, Kate.
Hi, here's the show.
Let me clean my camera first.
I got it.
It looks okay.
Here we are. Great to have so many of you tuning in tonight.
Oh yeah, that's great. There's like, yeah.
All right, Sueann, thank you so much for diving in. Let's start off with a bit of background and your fertility test and your fertility test journey.
For me, I think it was a bit different from probably how people realize they need to seek help for fertility issues. For me, because before I got married in 2014, I actually found out I have a cyst, ovarian cyst. That was actually due to a full body checkup, and they actually took blood tests on CA125. So CA125 is actually a blood test for ovarian cancer, and it was elevated. So that was actually how I found out that I needed to remove the cyst. Okay, but while removing the cyst, then they realized that I had endometriosis, and there were a lot of scarring in my womb. Like
Sueann,
really
that's quite a lot. Yeah, that's quite a lot to deal with all in one go.
Yeah.
How did you cope?
I didn't. I don't know, because when I woke up, then I realized, like, the gynae actually told me that, hey, you have a lot of scarring in your womb, and that's how I actually found out lah. You know, after you woke up from a surgery, and then they said like, oh, and then your tubes are also blocked. we tried to insert the HSG. They made, while I was like unconscious, sedated, they actually did the HSG test. And so when I only knew this when I woke up in my groggy state, and they said that, oh, my tubes were totally blocked. So most likely if I want to conceive, I will need to seek help. So that was how I found out, like that was actually how it linked to me seeking fertility treatments with a fertility specialist.
How did you, because it's not just dealing with the cyst, it's not just dealing with the endometriosis. I guess all these issues on top of one another, how did you navigate all of that?
Okay, to be honest, at the moment, hey, hi Kim.
Quick shout.
Okay, you're breaking up.
Okay, carry on, girls.
You're not really moving. Okay, hi.
Hey.
Okay, now, yeah, okay, so I'll continue. So basically, because this actually happened 1.5 months before I got married, and it was a huge blow to me. Like, imagine, like, you know, you're going to get married in 1.5 months, and then like your doctor suddenly tell you like, oh, you know, actually maybe you can't conceive naturally. Then I was like, okay. So I didn't really know how to deal with it. The only thing, probably like the biggest issue was whether my husband and me should carry on with the marriage first, right? Like he needs to be aware and also agree that we should get married. Yeah, so that was the only issue that I dealt with that time lah. After that, actually, to be honest, we really didn't, it wasn't really on our mind until 1 year later, because I was quite young then. I was only 26.
Wow.
So yeah, I got married at 26. But so I wasn't really thinking of also, like, you know, to start a family so soon. Like, you know, after marriage, we just enjoy each other's company for at least a year. Then 1 year later, of course, nothing happened because my tubes are blocked. No miracle happened. I was still praying for a miracle lah. Honestly, like every month, I hope that, you know, the tubes unblocked by itself, and then maybe I can conceive naturally. And obviously that didn't happen. So around 1 year and probably 4 months after my marriage, I decided to seek help with a fertility specialist. Yep.
So did your fertility tests, were they ongoing, or did you just have one block of tests all in one go?
One block of tests in one go. So basically, when you have a fertility check with, I don't know whether your gynae, or I actually went to a fertility specialist because I knew I needed it. So the number one thing is they will ask you about your background. If you go with your husband, they will ask you about both of your background. Probably they'll ask you some like health, like do you smoke, drink, some basic questions. After that, of course, they'll do a physical checkup. That means like physically they will do a ultrasound scan to see whether, like, you know, your ovaries, your womb, whether there's polyps, there's cyst.
Fibroids.
Yeah. So during that time, then the fertility specialist straight away told me that I got PCOS. And how he explained it was, oh, you see your eggs are like lined like a pearl of necklace. Yeah, you know, and that's PCOS. That was like, wow, what great description, but doesn't sound, but you know, PCOS is not a very nice word to actually, you know, to be diagnosed with. So I was like, okay, so now I have another issue to deal with, PCOS. Yeah. Then after that, they will actually send you for a lot of tests, like to test your FSH, your AMH. I remember it was a lot of tests, blood tests. It was around like 16 tubes, I think, if I didn't remember. Was yours 16, Kim?
No, mine was very different to yours, I think. Yeah,
Ah. Oh, okay.
yeah.
So it's a different type of fertility checks.
I think
Yeah,
because for
Kim, tell
you,
us
yeah. So,
tell us
okay,
about yours
basically for
then.
me, it was very different. Can you hear me? Yeah. Okay. So because for me, I had two kids naturally, so we didn't have any problems or anything. And then I got pregnant actually really soon. So we got married. I got married when I was 26 as well. And then
Wow.
2 years later, we decided to try and we got pregnant. And then we had our first son. And a few years later, we had our second son. And everything was okay. And so I think from the start, we knew we wanted to have three kids. And but when we started trying for the third one, we pretty much tried pretty soon after we had the second one. And we realized probably 2 years into it, nothing was happening. And so we went to our gynae and he did a basic check for us. So for me, basically, they didn't even do an AMH test. It was just a thyroid test, a T4 test, and they did a sperm test, a normal motility sperm test for my husband. And they said it was basically probably a problem with my husband. So from then on, we thought that it was just his problem. So he went on supplements, he went on Profertil, and he was on that for 2 years. We just carried on taking it basically. And then we kept trying. And then about 4 years later, we went to NUH to do another fertility check and everything. And the doctor basically had a look at his sperm test and he said, oh, there's probably no problems with him, but the problem probably lies with you. So then we did another test at NUH, but it was only an AMH test. Yeah. So one simple test and they said, oh yeah, your AMH is low and that's probably your problem. Yeah. So then from there, basically they said, let's do 2 IUIs. So we did 2 IUIs and nothing happened. And then we proceeded to IVF. And so we did a retrieval. So I had 10 follicles, 7 was retrieved, 5 mature, but only 2 fertilized. And then we put both back in, but still nothing. Yeah. And then so now we're going on to a private doctor instead of NUH because they're closing. Yeah. So we've gone on to the private doctors and they did a full test again. And surprisingly, my AMH went up,
Oh,
which is, yeah, okay, not by a lot, but by a little bit, it went up. So I think the difference is probably prior to the first AMH test, I was not on anything, no supplements, nothing at all. And then since then, I've been on a whole ton of supplements and then protein and this and that. So it actually went up from a 4.7 PMOL to a 5.8.
oh my
So I'm glad it
goodness.
didn't go down. Yeah, that was the main thing. I was really worried in 6 months, yeah, it would go down. But yeah, and then they tested my husband. So this time at the clinic, because this clinic doesn't only just do a normal motility test, they do a motility test, a DNA fragmentation, and OSA, which is a stress test on the sperm. And they found that, so previously he had, is it teratozospermia? Yeah,
Yeah.
where it was less than 1% was normal. And then I think after, they said there's a lot of echo in the background.
Yeah, I read that.
Can
Is
you
there
hear?
a lot of echo?
I don't know, Kim, is it your earbuds? Sorry.
Is it me? Is it me? Is it me? I did hear a
I
lot
can
of
still hear
echo
an
though.
echo.
Is it me?
It might be you. It might be
I can
you,
hear an echo.
Sueann.
Let me exit first, okay? Let me try.
Okay. Can you hear me? I can hear you. Sueann, I think she might be logging off and coming back.
And there's no more
Anyway,
echo.
Kim, you can
Yeah.
you continue. Talk about all
Yeah.
the tests your husband did.
Yeah. So this time round, so as I said previously, so he had a sperm test done in 2019, and it said that he had less than 1% of normal sperm. Okay, so we thought the problem was him, and so from then the doctor said, go on Profertil. Okay, I think we didn't ask the doctor how long he should go on Profertil for, so we just kept on going. He was on it for 2 years, which only recently when we went back to the
fertility doctors. They said that he actually only needed to be on it for 3 months to see a difference. But anyhow, he was on it for 2 years, and apparently his sperm went up past normal. So it's gone up to a 4.5% now, which is normal
That's
sperm.
awesome.
Yeah. So this time around, he did a sperm DNA fragmentation and an OSA test. Okay. So with the DNA fragmentation, what they can see is basically how much, even though for a guy, if he has normal, like let's say 4% sperm motility, but these sperm could have something wrong with them, whether the head is a bit bigger, they have 2 tails, 1 tail, things like that. So the DNA fragmentation basically tells you what their sperm looks like. Okay, so he had that and it was totally normal. But with the OSA test, okay, what the OSA test tells you in layman terms, okay, so basically when the sperm, to come out, it has to mix with a liquid, the semen, right? So the OSA test is basically testing the semen itself to see if there's any problems with the semen. So with his stress test, they found that there was a problem. So in terms of fixing this problem, they can't actually fix it through supplements or anything. But the only way they can fix it is that when he actually gives his sample for us to do the fertilization, they'll give him a bottle filled with a certain liquid, right? And then so when he basically gives his sperm, the sperm will go into this liquid and it'll kind of fix that problem. So that's quite interesting because, I mean, if we hadn't done that test, we wouldn't have known that that was a problem. Yeah. So that's probably one of the things that we did.
Were those additional tests quite expensive, Kim?
Okay, when I did the normal AMH test at, the normal test that I did in 2019 at a gynae cost me about $300, and that was not even an AMH test. It was just a T4 test, a thyroid test, a basic blood test to just test progesterone and things like that. When I went on to NUH, we did an AMH test and a thyroid test, and that cost me $200 as well. Okay, this time round, going on to private, I really expected it to be a lot more expensive because I wanted to do a full range of tests, but it cost us $630, which actually included the consultation fee of $200. So essentially it was $430, and they tested everything. Yeah. So it wasn't as expensive as I expected. Yeah.
Yeah, was it a fight? Did you have to sort of push for these tests, or do they come as standard?
So basically, we expected that we would probably have to ask for these tests, but when we went to see the doctor and everything, straight up, he said, oh, if you want to do a full test, we'll do a full test for you. So yeah, so I didn't realize there was that many tests because I would presume that when I went to the public hospital, NUH, they would have asked me to do all these tests in the first place. So I didn't realize there was actually a lot more tests than what was required there. Yeah.
Yeah. Kim, is there anything else you'd like to add before we move on to our viewer questions?
No, I think we can move on. Yeah.
Okay, I'm just trying to find. Oh, here we go. Bear with me. I've just got to invite. Sueann's coming back on.
All right.
Echo free. Here we go. It's just connecting now.
Okay.
Hello.
Was it me?
Yeah.
Is this better?
It's a little bit better. I don't think it might be worse.
Yeah. I can still hear the echo. Have you got another phone on or something? Is there something else? Because we can hear our reply.
Oh.
Okay, wait.
Then maybe my phone is having an issue. My phone is spoiled.
I think it's okay now. Hold on.
It's okay now? Is that okay now?
Yeah.
Okay. I think I know what's the issue. It was the stand.
Probably the echo from the stand. Yeah. Sometimes that happens.
It was the stand that I was using. I'm so sorry, guys. So sorry.
Oh no, Sueann, I don't think it's improved.
Oh wait. No, it seems to be back again.
Is it better now?
No.
Oh, this is weird.
Such a shame.
Such a shame. Okay, never mind. You guys continue.
Do you have another phone?
Do I have another phone? Okay, hold on. I'll try to. Okay, you continue first. You continue first. But if I do not talk, do you still hear the interference?
Yeah. Okay. Try with another phone and we'll have you straight back.
Okay, sure. Okay.
All right. Kim, let's move on to some of the questions.
All right.
So hopefully you feel like you're in a place to answer these on your own. No pressure.
No. I'll try my best.
So thanks so much. We had quite a lot actually come through this week, so that's amazing. Thank you. Couldn't do this without all our viewers, so that's really good. Just keep it coming, and I'm glad that it's clearly of some benefit to you guys. So let's go with this one. If I have a pre-existing autoimmune disease like thyroid, should I do any further tests?
Honestly, okay, I'm not too sure about this, but I know that thyroid test is something that all doctors will do. Okay, as soon as they find out there is whether your thyroid is a bit higher than usual, they will send you for extra tests and they will give you medication. Okay, I'm not sure what extra test there is, because all along my thyroid was pretty normal. But I've had friends who have had thyroid issues, and usually they will try to settle that first before you go on for IVF or whatever, because it can get quite serious if you're pregnant with thyroid.
Yeah. Okay, moving on to the next one. This is one that I feel applied to me when I was going through IVF. Vitamin D is not tested as a protocol. Isn't it an important nutrient for conception? And I was put on it. I don't know about you, Kim.
Did you do a test?
I didn't do a vitamin D test. No, I was just.
Neither did I. Okay, so I read the book. It started with an egg, right? So on it, it said that we should go on it. Okay, but I never tested for vitamin D. However, I know that Sueann did. So when she went to her fertility doctor, they told her they did the whole test, and they found out that she was vitamin D deficient. So that means that, okay, vitamin D is basically something that if we go out in the sunlight, we should get vitamin D. So it's pretty normal. So it's not something that we usually have to eat. But for Sueann, she had to go on injections, and I think she went on medication as well. But for me, I never tested, but after reading the book, and I realized that it was quite important, so I just bought it myself and I went on it. Yeah. So how did you decide to go on it?
It was just part of my protocol. I didn't really have a say. Didn't have a say in the matter. It was like, you're going on it anyway.
And this was in the US.
Yeah, it was in the US. And also, yes, I'm a bit rosy right now, but I'm not I'm not a sun worshipper. So, and I did, at the time, I was spending a lot of hours either at work or in the gym rather than playing.
So not really in the sun, is it? Yeah.
And I guess this is a question, and I think you kind of answered it in your protocol. Are the tests conclusive? If my levels are low, is there anything I can do to change it? And of course, you are living proof that your numbers can change.
Okay, which test are they talking about? AMH or just a normal?
It doesn't say actually specifically. It just says, are the tests conclusive? Yeah.
Okay. The thing about, let's say, AMH or most of the tests, they actually can change. If you go on supplements, they can actually kind of change within a 3 to 6 month period. So usually within a 6 month period, a doctor will tell you to go for test again. I mean, this is what the recent doctor told me. So he said that I should, because of the fact that I did test 6 months ago, he said there would be a change. And he was right. Apart from AMH going up, all my other figures like thyroid was, it was never high, but it went lower. Okay, and in terms of progesterone and things like that, everything went better. But I think that's to do with supplements. So that's why I think supplements are so important. Yeah,
I'm with you on that. I definitely saw a notable increase in my numbers with supplements. We've covered this with various sperm tests. Any remedies to help increase sperm count? All I can say is, in our personal situation, my husband, the issue wasn't with my husband, it was more me and my age. But I know during the process he was on zinc supplements and a multivitamin, and that definitely boosted his numbers. Also, he gave up alcohol. He's not a smoker.
Yeah.
He removed his cell phone from his pocket, didn't have the laptop on his
Ah,
lap.
okay. So the little
Yeah,
stuff.
and gave up cycling for a little bit as well. Did other sports.
But did you do a test before and after, or basically you just presumed that those are things that he needed to do and you went ahead with those?
Yeah, the latter. Just presumed that, gave it the best chance. The only test that he had to do, obviously he had to give a sample. They looked at the sample, realised quite early on that the issue was the issue wasn't
have an
him.
issue.
We did do a genetic carrier blood test, both of us, because we both have Eastern European origins, and so they just wanted to make sure that, one, it wasn't too close, and that we weren't carriers for the same disease. So, but I guess that's specific to our backgrounds.
Understand.
Okay, when is the best time to do an IUI? Before or after ovulation? You've had two, I've had one. All three unsuccessful.
No. I mean, prior to doing an IUI, I always thought, okay, maybe it's a chance. But now, if you ask me, honestly, don't waste your time. You know, I mean, I think out of 100 people who have done IUI, I've probably heard of one being successful.
Yeah, same. Yeah.
So, okay.
And I know the statistics are good, but I wish I hadn't wasted that $500. That's the only thing.
Exactly. And time, I think, because I started in August last year. If I had gone into IVF straight away, I would probably have been able to fit in probably 2 cycles in a public hospital instead of having to go to a private hospital now. Yeah. But okay, I mean, in terms of the question, you
live and learn, Kim, don't you? I feel like with that one, if you go for IVF, you're monitored within an inch of your life, and I feel that with IUI I wasn't, and so they sort of said, okay, well, we can give you a trigger shot, or you could just go see if it's natural. Do you want? It's a Sunday, so we won't give you your trigger shot. You'd have to do it yourself.
Did you do a IUI or a SO IUI?
Oh no, just IUI.
Yeah, okay, same, yeah.
And, you know, we hadn't really discussed or got our heads around injecting ourselves. It was just like a lot of the time. So that was just a bit of a waste of effort and a waste of hope. I wish we'd just gone straight to IVF. Anyway.
Same. Do you know, after I did the first time, okay, so the doctor said, oh, okay, maybe you should try it one more time. So I did it the second time, but do you know, on the day that we, so I did a scan today, and then tomorrow we went to the doctors to get it fertilized, and we put it in to get it fertilized. And the doctor said, oh, it's going to fail anyway. So you're probably back for IVF. And I said, how do you know that it's going to fail? He said, oh, because from the scans yesterday, it didn't show that your follicles were really good. So in my mind, I thought you should just told me yesterday and wouldn't have wasted my time coming today to get it done. Yeah, you know, so, but yeah, I mean, we learn. Exactly, we learn.
Yeah, big shout out to Sueann, Ted. Thanks for your messages. Yeah, you are in the right place. You are very much, you found your people, shall we say. Lucky Gal 2019 says, what supplements did you eat, and can you recommend any?
Okay, wait, let's answer the question first. So the question just now asked, do you do the IUI before ovulation? Yes, 100% before ovulation. After ovulation, it's too late to do an IUI, basically. And the doctors will tell you that anyway. They'll tell you exactly what to do. Yeah. So, okay, supplements, from the time that I was, the few months that I had between both tests, okay, I was on CoQ10, okay, which I went on the stronger dose, which is Ubinicure. Okay, CoQ10 is supposed to take 600 mg, which is a lot, because in a bottle, sometimes you only get 30 tablets, you know, and you're probably taking 3 to 6 a day. So one bottle won't last you really long. Yeah, so, but that's the right dosage, 600 mg. Hi, Sueann.
Hey, is this
third time's a charm?
Much better.
Thank you so much. So sorry, guys.
Yeah, so Ubinicure, I was also on vitamin C, vitamin E, multivitamins, and I went on protein powder, which is horrible, but yeah, I just took it every day anyway. So that was all I was on before I did the next test. So those were the things that probably improved. But since then, I've also started on DHEA, vitamin D, biofolic. It's just taking a whole meal a day, just supplements, yeah.
Yeah, Kim, I was exactly like you. Yeah, all those additional ones. Also, I ate a lot of salmon, avocado, pomegranate, nuts. And I did gentle exercise, but certainly sort of no spinning, no heavy pounding. And just kind of looked after myself, and that's what I would say to others. Grace with a great question here. Heard you ladies with unexpected infertility. Can anything still be done?
Okay, maybe I can answer this question. So, because just now I also didn't continue my story, right? Okay, so basically after that I realized after I have blocked tubes, and okay, I did both tube removal, which the medical term for it is too long. So anyway, I removed both of my tubes, and I actually did IVF after that. Then unfortunately I had three failed implantations, 3 transfer, all failed. So it was very perplexing because like I was quite young, like 28 only, and yet okay, my eggs were okay, not say like the greatest, but my AMH was fine. It was 20 plus, is considered quite good, right? But my FSH was quite bad. Other than that, I do have endo and adenomyosis, but okay, all those can be treated, okay, and it was treated. And so eventually my doctor did send me for a recurrent pregnancy loss test, although there's no pregnancy loss, but I mean recurrent failure of implantation, it does also like almost the same as like, you know, pregnancy loss in the IVF term. So after the recurrent pregnancy loss test, then I found out that I have an autoimmune disease, which is antiphospholipid syndrome.
Wow.
And high NK cells, which is natural killer cells. So for people who have unexplained infertility and you did try IVF before, and there is probably no implantation, or especially those who have non-implantation, I really highly recommend you to do a recurrent pregnancy loss test. Most of the hospitals do have, so you probably need to go and ask your doctor for it. And from there, probably you might find out something. Yeah, but yeah, that's if you find out something, then of course you will need to go and treat it lah.
Yeah.
We obviously, tonight's topic is all about fertility testing. Sueann, we found out that you did yours early on, fairly young age. Got a question here about when really you should do fertility testing. I want to say I did mine at 34, and it was a bit of a rude awakening.
Yeah.
For me, after going through all these, I feel that the younger that you know, better. So actually we should have done some like fertility education since like maybe when we are studying. So like when we reach 21, okay, everybody should have done some fertility testing, so that, I mean, of course, I do hear of cases, unfortunately, they do have premature ovarian failure, which is really very upsetting. Imagine like we are getting married at 20 plus, and they actually realize that they do not have any eggs anymore.
Yeah. No, I definitely think so as well. Yeah, because so ever since doing the test, I've been actually, you know, friends, family, and everything, I've been telling them, if you plan to have a baby, go and do a test. So I was even talking to the girl that does my lashes for me. She's only 21 years old. So I was telling her about how I was going through IVF and everything, and I said that, oh, you know, she said, oh, she's probably planning to get married in 3 to 4 years' time. So I said, you should go for a test. I mean, whenever you should. So happened that she thought of me and she said, okay, since I'm free, my shop is closed for a week, I'll go for a test. She went for the test, and the doctor said, oh my God, you have a cyst in your ovary that is about to burst. And she went in for an emergency surgery to get it removed. So the next time I went to do my lashes, and she told me, oh my God, I've been on bed rest for a month and everything because it was so serious. And if you hadn't told me to go and do a fertility test, I would have never found out, and it would have burst. And they said that they probably would have had to remove all her ovaries and everything, and she probably wouldn't have had kids. So honestly, tell your friends, tell everybody, go and do a test. If you plan to have kids anytime in your future, just go and have a test. Yeah.
Even if you're very young, like 21. Yeah.
Just go. Yeah. It's no harm. It's just a bit of money, but at the end of the day, it's worth it. Yeah.
Yeah, and it's just about sort of taking control over your body, really. I wish I hadn't have just sort of sat around and just accepted, oh, my periods are painful. Well, maybe there was an underlying reason for that, and then of course that had ramifications later in life. So okay, sorry, let's just go back to the questions here.
Oh, Sueann, vitamin D, you did a vitamin D test, didn't you?
Yep, I did. But it's actually my doctor sent all the patients for vitamin D testing. So because I read the questions, some of the I mean, there was a question that in NUH, is it they don't test it, or is it?
No, we never tested. And Kate was saying that she never tested her vitamin D either. So I mean, we're quite surprised that you actually got yours tested. Yeah.
Yeah, it was one of the 16 blood tests. Yeah, one of the 16 blood tests that I tested my vitamin D. So I not very sure why. Okay, so basically my gynae was telling after that, when I test my vitamin D, I have low vitamin D, which after that, when I talked to my rheumatologist, when I asked her, I said, like, you know, I don't even carry an umbrella while I walk under the sun, and I don't even hide from the sun, so how come I don't have vitamin D? And she mentioned that some of our body just cannot convert the cannot convert sunlight. That means our skin can't absorb the sunlight. And yeah, that's why no matter what we do, even if you stay under the sun for very long, your vitamin D just won't go up. Yeah, so that's probably what's happening to me. And I have on D-Cure, I think 25,000 IU per week.
Wow, 25,000 is really high.
Yeah, it's like in a liquid form. It's not even in a pill. Then you just like dip it inside. It tastes a bit like oil.
Nice.
Not very nice, but yeah, it's just like dip it. Yeah.
This is a good question. I know it comes up in the news here a fair bit in Singapore. Is there PGT or PGS testing in Singapore?
Sueann?
Me? Okay. Okay, so for PGS testing, there is PGS and PGT testing, but it's all in the government hospital. So PGT is the one with, if you have some genetic issues yourself, and then hereditary issues, and you want to eliminate that, right? Yeah, then you can do the PGT. PGS is still kind of under like the pilot program. They mentioned that they do not have a lot of people wanting to do PGS in the first place. There is PGS in Singapore, but it's just that it's in the government hospitals. That's one. And if you want to touch on the PGS as a private patient, right, you will need to hit some of the criteria, which means like your age. One is your age, one is recurrent pregnancy loss or recurrent implantation failures. And so you will definitely need to write in for an appeal, like, you know, you want to send your embryos for testing.
This is at a public hospital, right?
No, as a private patient in any other centers. You can, I think it was a recent news. Yeah. But that said, there's a very, there's a few steps that you need to do. Like you still need to ask for permission from the probably MOH or something. Yeah. Then you need to transfer your embryos to the public hospital centers to test. And all these are
I did
additional
ask.
costs.
Yeah. Do you know how much
Yeah.
it is?
It's at least 6,000, is it?
Wow.
From what I know.
I think
And
so.
they only test like 4 embryos and above. Correct?
Wow.
Someone can correct me if I'm wrong. This
I'm
is
not
what
too
I
sure.
heard from a friend that wanted to test her embryos. Yeah, I think it's 4,000.
I know
6,000.
from my
Six.
clinic,
6.
basically, I asked the doctor whether they do PGT or PGS testing. So what they do is that they would collect your embryos here, fertilize it. The eggs, fertilize it into embryos, and then send it to Malaysia, JB, because they have a clinic
Yes,
there.
that's
Yeah. So,
my center also does that.
the problem is that they can't bring it
but
back. Yeah, that's the thing.
Oh,
So,
talking
just
my language.
so you
yeah, until
so
they
you got to
open.
fly there. Yeah, you got to
Fly
fly
there,
there.
or I think right now you
Not fly or
can
drive there.
you can
Drive.
write you can write to the Ministry of Health. You can write to the Health Minister, explain your situation. Because we can't travel and people are putting their lives on hold. I think there's quite a lot of empathy out there, and you will just get a permission from the higher ups that you can continue.
But I think it's quite a lot of hassle, isn't it? So
yeah, it's a lot of hassle. You definitely need to ask, get permission from MOH whether if you want to transfer any embryos that are not from Singapore.
Yeah, so it's just adding to the hurdles, but we're experts at hurdles, so
That's true. True.
Yeah, what's another one, eh? So we love getting your questions in the week, and we love getting your live questions. We have one here. Can D-Cure be bought over the counter?
That I'm not sure because my doctor actually prescribed it. My rheumatologist, not my gynae though, not my fertility specialist.
How do you manage
So I'm not very
IVF
sure.
procedures, like visits to the clinic and everyday responsibilities such as work? Yeah, it's really, really tough.
you just
But you can do it. But do it.
Yeah. If
Bring
you
your
want
laptop
it,
to
you
the
gotta do it.
clinic.
Yeah.
Bring your laptop to the clinic. Yeah.
Yeah.
I guess there's a long waiting time. I mean, if you want it on weekends, you're just gonna wait really long. So if you want it on a weekday, then I guess you just have to take some time off work and this and that.
Yeah. Also,
everyday responsibilities such as honestly, having a child is a much bigger responsibility. Well, I think it's really much tougher to do IVF now. I mean, I've been going through to try for my second one. So
how old's your first one now, Sueann? How old's your first one?
27 months.
And Kate, how old's your son?
11 months.
Wow.
Yeah.
This is the time when it's the toughest, but worth it.
Kim's two children are quite big already, right?
I have a 8-year-old and a 5-year-old.
Oh,
that's
Yeah, see, these are great tips. COVID, work from home really helps. Bring your laptop to the clinic really helps. If you can get the first appointment in the day, I found that really helped me. Yeah. I don't know what what the relationship is like with your bosses, but I know that I pulled aside a male boss and then my female department boss, and we had a frank and honest discussion about what I was going to go through and the time implications and how I would make up the time. But this was gonna happen. Like I remember having to be like that we had some VIPs visit from India during the Masters golf tournament, and just I remember I was asked to meet and greet them, and then that was fine. But then the fertility clinic called and said, "Can you come in for a blood test?" And I was like, "Oh," but but it all worked out. Our VIPs had a nice time, and I went to the fertility clinic, so it's all good. Yeah, just good luck. It is a juggle, but you can do it.
Yeah, we're superwomen.
Yeah. Any more questions before we wrap up? I just give a moment. Oh yeah. So I don't know about you ladies. This is a question I wrote in. I don't know what it's like here in Singapore. Felt like the tests I did were half were blood tests and half were internal tests. So they were checking things like endo. I had the HSG. Sueann, you're so lucky you were under.
Ooh.
I was not, and never
I've
experienced
heard
pain
it hurts.
like it. I had 2 MRIs done because at one point they thought I had a heart-shaped uterus, but I didn't in the end.
What is the heart-shaped uterus? What does it make things different?
Yeah, so say your uterus is this shape. Mine, they thought mine was this shape, and so either baby just develops in one of these pockets and doesn't have the whole space to develop. So there's a chance that baby might not go full term, or the pregnancy can't progress the way you want it to, or
Interesting.
Yeah.
Okay.
So so I would say it was like 50-50 blood tests and then internal tests. What about here in Singapore?
Sueann, you probably did more tests. Can you hear Sueann?
Sueann, I can't hear you, love.
Can you hear me?
Yes.
Can? Can?
Yes. Yes.
Okay, can you hear me? Can?
Yes.
Okay. Okay, so for in Singapore, right, if the if the fertility specialist does not like that means sorry Kate, do you go through
Oh no! What a cliffhanger!
She's back.
Okay, Sueann, you broke
no,
up.
do you go through laparoscopy or keyhole surgery for all these?
I didn't in the end. I had suspected endo because the nurse said, "Oh, I can see what they call chocolate blisters on one side, on one of the ovaries." But then when the consultant had a look, she said, "No, I can't see anything that would indicate endo."
Oh, so you didn't do any like internal surgeries?
No, just internal
Okay.
scans.
That means like internal scans like hysteroscopy.
Yeah.
Should be,
And
right?
then also with the camera.
With the mirror. Okay. So
We've lost her. So okay, I did a hysteroscopy as well, and at the same time they found that when I did my IUIs, they realized that every time they tried to put the syringe in, I had some sort of blood come out from nowhere. So we did a hysteroscopy, and he found that I had certain cysts on the entrance of the vagina. Okay, you go into the vagina, and then there's another entrance that goes into the ovaries or the womb. Yeah, so in that entrance, it was full of cysts, and so they did a surgery to remove all that out. So that's what I did. But yeah, we didn't for scans for the fertility tests. Okay, blood tests were done on day 2. Okay, on day 12, we went in for an internal scan where they go in and they actually check all your ovaries and this and that. Yeah. And then from there, it was quite simple. So never had a HCG test or anything, but I've heard it hurts like hell. Yeah.
Yeah, it's only 60 seconds long, but it was a really
So
painful.
what do they do? So what do they do in actual fact?
So I think they insert iodine
Okay.
or an iodine mixture
From down there?
Yeah, from cervix into your uterus, and then it follows the outline of everything, so then you can see whether your tubes are blocked, the shape of the uterus, is it heart shaped, is it normal, that kind of thing.
Is there a reason why some people get it done under and some people don't?
Don't know. In the States, they don't put you under, they just say take some Panadol. Trust me, you need a bit more than Panadol. Yes, Grace, you need your painkillers before an HSG.
But no, I've heard of hysteroscopies where some are done under as well, and some not.
Sueann
Even at NUH, I was done under. Thank God for that. But I've heard of people who hadn't, and it really hurt. So yeah, so always get it under. Just get it done under.
Yes, I agree with finding coconut IVF. You just said HSG trauma. Yeah, I know. Kim, any more to add?
Nope.
It's been so great. We've had, I think we've had a record number of viewers tonight, so that's amazing.
That's
good. Just thanks so much for all the questions in the week, all your questions and advice that everyone's texting in, and HSG pain clearly triggered just so much of us.
Trauma, all the trauma's come back.
Yeah, just get it all out. You're in a safe place here, and we understand, and just thanks so much for taking part, and Kim, thanks for
no problem
for giving up your time for us this evening. Sueann, sorry it didn't work out. We love you loads.
All right. Bye.
We'll see you all soon. Thank you, everyone. Bye.